Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. We're going to be speaking with Andria Aird this afternoon, pharmacist and partner at Bloom's The Chemist, Australia's leading community pharmacy group. She's joining us on the program to talk about the alarming statistics on the physical and mental impact of poor sleep. Welcome to Health Professional Radio, Andria Aird.
Hello, thank you for having me on.
Great. Give our listeners a bit of your professional background, if you would.
Oh, certainly. So I'm a community pharmacist based in Perth, Western Australia. I have Bloom's The Chemist in Port Coogee, which is a local owner-operated store. Our focus at Bloom's The Chemist is to be Australia's leading community pharmacy chain. So our brand stands for being involved in our local community and ensuring the health and wellness of our local customers, our local community. So we live in our communities, we work in our communities, and we really want to see people achieve their best health outcomes out of their lives.
World Sleep Day on the 19th of March. As it's World Sleep Day, why is it so important to get a good night's sleep?
Sleep is imperative for our overall health. So we've seen that alarmingly 1 in 10 Australians can be affected by clinical conditions such as sleep apnea. But of course, there's many more of us who do suffer from poor quality of sleep. So if you've got poor quality of sleep, it can lead to problems like reduced immunity, obesity, depression, and then even further health outcomes as we get older, such as increased incidence of heart disease, stroke, diabetes, and then all the other consequences, of course, that follow on from there. So it can be very disabling, just something that we may not think is a serious health issue.
Why is it that the recommended amount of sleep for an adult fluctuates throughout the decades? I've heard 6 hours, 7 hours, 8, even 9 hours. What is the correct amount of sleep, and does it vary from individual to individual?
Yeah, certainly. This is something that's always up for debate, isn't it? We find that when we're babies, of course, we need a lot more sleep, and through our childhood, we need more sleep. When we get to adulthood, we find the ideal balance is, for most people, between 6 and 8 hours, leaning towards more the 8 hours of good quality sleep. And then as we get older, we actually don't need quite as much sleep. So you'll find that the elderly may not be needing as much sleep as someone who's, say, in their 20s or 30s. It does vary person to person, but invariably you find some people think they're functioning quite well. Oh, no, I'm fine. I'm sure we've all met those people that say, I can work fine on 4 or 5 hours of sleep a night, whereas biologically, we know that that's not optimum. It's putting pressure on a lot of the body systems, which can lead to poorer health outcomes as we get older.
Would you say that sleep apnea is as severe as insomnia?
Yes, as severe, yes, but in different ways. Mm-hmm. So with insomnia, the patient is acutely aware, of course, that they've got insomnia. We know that we're awake. We know that we're not sleeping. And then that also plays on our mind. That can cause stress, anxiety, and, of course, fatigue. And that affects all aspects of our lives. The issue with sleep apnea is that most people don't really know that they've got it. So sleep apnea can present as a lot of random or different sort of symptoms that you may not connect with your sleep. So most of my patients will come in and say, oh, look, I don't have a sleep problem because I'm asleep for 9 hours a night. But then when we do a sleep study on them, it can show that they're having very poor quality of sleep. So it's not necessarily the quantity with these people, it's the quality of sleep that they're getting. So when you've got sleep apnea, I don't know if you know much about how it works, but what happens is that the airways narrow, and it's often associated with snoring. The airways narrow to a point where the patient stops breathing, and this can last for anything from a couple of seconds up to, I've seen people with apneas, to a minute. So during this time, the brain is deprived of oxygen, which you can only imagine the dire outcomes of this. The body then rouses itself to a point of wakefulness to start breathing again. But it's important to note that this state of wakefulness is not necessarily a state of consciousness. So you start breathing again, but you don't even know that you've had this interruption in your sleep. More often than not, we see spouses or partners make the comment, oh, look, I hear her stop breathing or him stop breathing and then gasping for air again. So the person who has the condition doesn't really know. But the issue is that you're not getting into this very deep, restful, restorative sleep, which we all need for every system of the body. So that is really what creates the problems with sleep apnea. You're getting low oxygen levels because of the interruption in quality sleep and breathing, and you're not getting that restive, restorative sleep that we all need.
So how do you get a good night's sleep if you are suffering from sleep apnea and you don't have a spouse or a partner to give you a heads up?
Most definitely. So as a part of World Health Day this week, Blooms have joined together to create Australia's biggest Wakeup Call challenge. We're doing a free online sleep study quiz, which is very easy to access via our Blooms the Chemist website. So there's a few really simple questions on there. You click through. At the end, it will give you a suggestion, an indication of your risk for sleep apnea, and advise you of your next steps. So that's one way to go about it. The other way is simply to pop into your Blooms Chemist store. All of our pharmacists are trained health professionals, highly qualified in this area. Have a chat about your sleep. We do offer home sleep health tests, which are very easy, very unobtrusive, and we can go through that procedure with you. So it's a very efficient way of determining your level of sleep apnea. All the results from our high-level sleep study tests are assessed by a specialist sleep health physician, and within a week or two we get a highly detailed report. So that will give things like how many apneas you've had over the period, if you snored, what position you've been in when you're snoring, what your oxygen sats, how they've been affected, your hours of restful sleep, hours of wakefulness. So from that, the specialist sleep physician will then make an assessment as to whether you have sleep apnea, the severity of it, and then your next steps for treatment.
Well, let's talk a bit about this pandemic. It has affected us across the board, medically, financially, mentally. Are there any sleep issues that are on the rise that can be attributed to the COVID-19 pandemic?
Oh, certainly. I think that we can connect all of it. People who have sleep apnea, if you've got very, very mild sleep apnea and you improve your lifestyle factors such as increase your activity, if you're overweight, reducing your weight, eating healthy diet, helping to manage your stress, that can improve your sleep apnea diagnosis. So COVID-19, has most definitely affected us in every part of our lifestyle. We've been less inclined to be outdoors, or been able to be outdoors, be active. Some of us have been, our diet may not have been the same as it would have been pre-COVID, pre-lockdown. It's most definitely affected our mental health, and that we know if you're affected by depression or anxiety, that affects our weight and our overall health. So people might find that they're emotionally eating, they're putting on weight. The depression, stress, financial issues can all affect our quality of sleep. So more now than ever, it's important to get on top of any sleep issues that you can have. A really frightening statistic is that 1 in 10 of Australians are touched by sleep apnea, and that's a massive number. But out of this massive number, 80% of these people are not being properly treated. So there's so many of us walking in the community who are affected by sleep apnea, and if we could get more recognition and more treatment of this serious condition, we can improve the quality of life for so many people, which is what really we're all about at Blooms, is improving our wellness and our quality of life.
Andria, give us a website where our listeners can go and learn much more about Blooms the Chemist and about some of the issues in sleep health that we've been talking about today.
Certainly. So our website is bloomsthechemist.com.au. We're on LinkedIn, Instagram, Facebook. Also, the Sleep Health Foundation is a useful website. So that's www.sleephhealthfoundation.org.au. So that's online where you can find us. I would encourage you, though, just pop into your pharmacy. The great thing about our Blooms Chemist is that your pharmacists are always available to take time out to talk with you. So we're all trained health professionals. We're very familiar with sleep issues, and we can tie that into your overall health and other medications and other therapies that you're already having. So by all means, pop into the store. We can sit down and talk to you about your sleep health issues at any stage.
Great. Andrea, it's been a pleasure speaking with you. Thank you so much for joining us on Health Professional Radio.
Thank you so much, Neil. Take care.
You as well. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Andria Aird, pharmacist and partner at Bloom's The Chemist. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com/Health Professional Radio.